When the waters break, does it happen like it does in the movies?
Just FYI, my water broke.
My water just broke.
My water just broke.
I think my water just broke. My water just broke.
And my water just broke.
Water just broke.
My water broke! I'm having the baby.
Hi, I'm Nate, and we're going to talk about what happens when the waters break after 37 weeks. If you haven't yet subscribed to the channel, now's the time to do so, and give this video a like. Thanks! Pre-labor rupture of membranes occur to about 1 in 10 women who carry their pregnancies beyond 37 weeks. No one really knows why this happens, but there's evidence that suggests vaginal thrush increase the chance of this occurring. Sweeping the membranes when the cervix is greater than 1 centimeter dilated is also associated with the waters breaking. There's also evidence suggesting a high intake of vitamin C and E can increase the chance of pre-labor rupture of membranes. The amniotic membrane can be thought of as a fluid-filled sac which protects the baby from the outside world. Therefore, when the waters have gone, there is a breach in this protective sac which can expose the baby to harmful pathogens like Group B strep. In fact, there's a higher risk of severe neonatal infection in cases of pre-labor rupture of membranes compared to those whose membranes remain intact at the onset of labor. Most women whose waters have gone will experience either an unexpected popping sensation followed by a sudden gush of leaking from the vagina, or it may be a slow constant trickling which is more noticeable when upright or moving. It is sometimes difficult telling apart urinary leakage and the waters going, particularly if you've carried pregnancies in the past, as incontinence can happen at this later stage of the pregnancy. That's why it's important to be doing Kegels. Thus, if you think your waters have gone or if you're unsure, please speak to your healthcare team and they can provide further advice. If your healthcare provider suspects that the membranes have ruptured, they may ask for you to attend the maternity unit for an assessment. This can include a feel of your abdomen to assess whether the baby is lying vertically, with the head presenting into the pelvis, a listen in to baby's heartbeat, and also your observations. Of course, we also wish to confirm the diagnosis of pre-labor rupture of membranes. To start with, we will ask for you to describe the leakage you've noticed and to assess the pad you're wearing. If that isn't enough to confirm the diagnosis, we may perform a speculum examination, which is safe, to see if there's pooling of amniotic fluid within the vagina or leakage from the cervix. Occasionally, we may still be uncertain as to whether the membranes have ruptured. We can take special swabs during the speculum examination to see whether the fluid in the vagina is amniotic fluid. Once a diagnosis of pre-labor rupture of membranes is confirmed, in the UK we have 2 ways which we can manage the remainder of the pregnancy. The first option is to manage it expectantly, as up to 80% of women will go into labour in the first 24 hours of the membranes rupturing, and 90% will be in labour in the first 48 hours. For women considering this option, we advise checking your temperature regularly at home, observing the colour and smell of the fluid, as you're likely to continue leaking until the baby's born, as well as observing baby's movements. We advise avoiding sexual intercourse, but baths and showers should be fine. If you have any of the following concerns, please contact your healthcare providers immediately. If there's a prolonged interval between the waters going and the onset of labour, you may be offered antibiotics prophylactically during labour, and your child may require observations in the hospital after birth. In the event that labour doesn't occur spontaneously, we will discuss scheduling an induction after 24 hours of the membranes rupturing, though you may wish to wait for longer, but speak to your doctor about this. This may be advisable, especially if there are risk factors which makes the pregnancy and labour riskier. A Cochrane review of all available evidence suggests when compared to women who received expectant management, those who were managed actively were less likely to have an infection called chorioamnionitis or endometritis. They spend less time in hospital, without an increased risk of requiring a caesarean birth. Therefore, opting for an active management even if the pregnancy is low risk may still be a sensible option for you. Please click on the like button if you found this useful. Share, subscribe, and I'll see you again soon.